I hope you all had a wonderful weekend. I know we are in the middle of Ramadan observation, and my friends who are celebrating Passover are halfway through. And obviously, those of us who celebrated Easter, I hope it was a wonderful celebration and that you got some time with family. And we saw that togetherness happen last week in Vineland when the Fusion Church came forward with 100 Easter baskets. Just a reminder to staff of how much they appreciate everything that we've done and how critical the staff have been in getting us through these very dark days of COVID. Our numbers have stayed about the same, but the sort of warning shot over the bow was that North Jersey went yellow in reference to the visitation in hospitals. That means the transmission rate was so high, as well as the fact that they started to see some uptick in the hospitalizations. We've not seen that yet. There's no reason to panic, but it is something we certainly keep our eye on. In addition, as we've seen the availability of COVID vaccines in our retail pharmacies and CVS and Walgreens and others, we are going to begin to take down our 10 operations. I'd encourage you, if you're still in need of a booster or a vaccine, please feel free to come in. But we are going to be redeploying staff back into the operations given that the volume has dropped. So in April, we have two important recognitions that I'd like to bring to your attention. The first is the partnership that we have with the Gift of Life organization that increases awareness of organ donation and the importance of it during the month of April. There are people waiting today for those important services if they were to become available, and it certainly could change the course of their life. So we thank you for your consideration of this request. In addition, April is also Minority Health Awareness Month, and there's lots of work that's been going on at Inspira in reference to really identifying the social determinants of health and understanding how we can do a better job of working with our others in the community to really decrease the barriers to accessing healthcare. We were thrilled to join Horizon in their Neighbors in Health program, really supporting our community members to establish a community health worker. And our first community health worker, Maria Alvarado, is dedicated to the Millville community. While Maria is partnered with our Cumberland Family Medicine and our Millville Inspira Medical Group practices, she can assist any resident in Horizon Insurance who lives in our Millville area. And Maria says she loves supporting people in this way, and we've seen through our own community health needs assessment that this is critical. Many people in our communities are eligible for services that they're not aware of. They have indicated to us as we've gone through that needs assessment that their fear of how much the out-of-pocket cost would be or the cost of the medicine prevented them from getting care. And we know that what happens then is people just show up much sicker later in our emergency room when it's much more difficult and much more costly to care for them. So we thank Maria and all of those that have been involved in this process, and we really are looking forward to sharing with you continued great success. You know that we've been on a journey here at Inspira. These videos are part of that, but really trying to make sure that we have established both internally and externally in the organization our clear commitment to the community and most importantly to our workers who have fought so hard during this global pandemic. I'm thrilled to tell you that we have been one of the few healthcare organizations recognized as a top workplace in 2022 in the Philadelphia, South Jersey region. The company by the name of Energage does this survey. They randomly select employees who they send surveys to, and I'm thrilled to tell you that more than half of our employees responded, and they gave us some very good feedback. And part of that feedback was how committed they were and the organization is to patient safety. We actually ranked in the 99th percentile in the response to that question from our staff. And I really am very proud that they feel our commitment to safety and that I hope you do as well. Until we meet again, be well and stay safe.